I'm going to call this meeting to order. So hello, everyone. My name is Brendan, and I am the co-chair, along with Doug Brown, who's also present on this Zoom panel, of the Hamilton Coalition to Stop the War. And this is in Hamilton, Ontario, Canada. And we were going to initially do a land acknowledgement, but I understand there are some issues with doing so. So what I'm going to do is just be direct in what we want and are saying. I'm speaking on behalf of the Hamilton Coalition to Stop the War here in Hamilton, which is on the traditional territory of the Haudenosaunee and Anishinaabe peoples. And in view of the land reclamation now taking place by people from the Six Nations Reserve, a few kilometers from where I sit, we call upon the provincial and federal governments to meaningfully consult with the recognized leaders of the Iroquoian Confederacy before any construction proceeds on lands claimed by the Six Nations. Please note that this panel discussion will be recorded and posted later on social media for the benefit of people unable to participate at this hour. So we were going to begin with Dr. Margaret Harris with a short introduction. I believe that's been bumped to see if she's available a bit later. So I want to start with our panelists. And I'm going to have Hannah introduce our first panelist. So let me tell you about Hannah briefly. Hannah Marcus is a member of the Hamilton Coalition to Stop the War Executive, and she is co-host of this panel discussion. She just graduated with an undergraduate degree in health sciences and a minor in globalization studies from McMaster University. She'll be starting a Master of Science with a specialization in global health at the University of Alberta next month, and hopes to conduct research related to climate change and human health for her thesis. So I'd like to welcome Hannah, and she'll be joining us momentarily.
Hi, thank you so much for the introduction, Brendan. It's great to see everybody joining us today. I'm happy to introduce our first speaker, which is Dr. ATIF KUBURSI. ATIF KUBURSI is an Emeritus Professor of Economics at McMaster University in Canada. He's also served as the Acting Executive Secretary and Undersecretary-General of the United Nations Economy and Social Commission for Western Asia. In 1981, he worked for the United Nations Industrial Development Organization as Senior Development Officer and was consultant to the organization throughout the 1980s, 90s, and 2000s. He consulted regularly with the UN FAO, UNCTAD, UNILO, UNESCO, UNEP, UNNDP, and many other international organizations and governments. He's also authored 12 books and over 280 papers and refereed academic professional journals and technical reports. I'm pleased to introduce him, and you may begin, Alan.
Yeah, thank you, Hannah, for your generous introduction. I'm delighted to be part of this panel. The United Nations has always been held in question in some quarters, totally unjustifiably. And the work it does, as you know, its overarching commitment is to prevent a third world war, given that the fact the League of Nations that preceded it had failed to prevent the Second World War. So far, cross our fingers, it has succeeded. The main mandate also includes social economic support for vulnerable groups and countries. And the WHO specializes basically and fundamentally in health issues, trying to direct and coordinate the well-being and the health of the people, particularly in the third world, particularly vulnerable groups. It has a mandate to oversee the implementation, the realization of the Sustainable Development Goals. And these replace the Millennium Development Goals. It is a collective effort on the part of the people of the world to address some of the major issues and vulnerabilities of people around the world. WHO is a specialized agency. Typically in the United Nations, you have those that are part of the Secretariat. UNDP, United Nations Development Program, for example, is part of the Secretariat. The OCHA, which is the Office of Coordinator or Humanitarian Assistance, is also part of the Secretariat. ECOSOC, Economic Social Council. On the other hand, the WHO and FAO, Food Agriculture Organization, many other called specialized agencies. This means that they are still within the umbrella of the United Nations, but they are governed by boards that are elected in many respects, to some extent, unlike the General Secretariat of the United Nations. One country, one vote. When it comes to boards and they have independent budgets, they tend to be governed primarily by allocating votes to the donors. This, to some extent, is not an accurate description of WHO, because it has to come to the General Assembly every April, since its inception in 1948, for what's called the World Health Day, and it tries to involve the countries in the General Assembly. 150 countries are members of WHO and contribute to it. The most interesting thing about the WHO is that it operates in these 150 countries. It has 150 offices around the world in 6 regions, and it employs about 7,000 people. Its major fundamental mandate and is defined every biennium budget for every 2 years. The one for 2020-2021 was just approved in 2019. And it really involves what they call it, the literally the biennium. And I'm trying to see if I can share my screen. I could show you some of the things that they do. And it would be really interesting to see how the United Nations now is trying as much as possible to get what they call the 3 billion. 1 billion is to increase universal coverage. The other billion is to address the problems, health problems of the vulnerable countries around the world. And the third one is to increase 1 billion the capacity of countries to address health issues. The story that is really important here is to find a way in which this World Health Organization, which is fundamentally and in a most direct way responsible for much of what is taking place in the third world, get the empowerment to deal with these health issues and the well-being. But it is really more, related to the following Sustainable Development Goals: number 1, 2, 3, 4, 5, 6, 11, 13, 16, 17. I mean, the only missing ones is really about like 7, 8, 9, 10, and 12. Every other one, the WHO is committed to implement. I'm trying to, show you a bit these things, but it doesn't seem to be. Let me see if I can. Yes, here it is. Can you see my screen? All right. This is the program budget for 2020, and the major commitment here is to increase by 1 million more people to benefit from universal health coverage, and another 1 billion more people to be better protected from health emergencies, and 1 more billion enjoying better health and well-being. The commitment for these 3 billions is now the defining objectives of WHO and the way it works in the system. But in a specific way, you'll find out that the commitment is really in a way to get a focus on measurable impacts to improve people's health. And the second priority is work to drive public health impacts in every country and demonstrate how resources could be aligned in such a way to delivery of these improvements, and to change from a disease-specific approach to a more integrated health system-oriented approach, and align and build synergies, developing and delivering the work of the three levels of the organization. But as you can see, that the most important thing, which is now the GW, which is the Global Planning Work Program of the organization, is this 3 billion, trying to increase health coverage by 1 billion to protect people against health emergencies, and to improve the capacity of people, particularly vulnerable group, to have better health and well-being. But as I said, to a great extent, what is really important here is that the measurable objectives is to save 30 million lives, all right, by basically and fundamentally protecting them from being vulnerable to disease. And they believe that if they were to achieve these things within the budget, they will literally increase 100 million healthy life years will be improved, and it will achieve 2 to 4% economic growth because of increased productivity that usually comes from improvement of health. They've really said that for every dollar you spend or spent by WHO, about $5 is realized in benefits. It's literally about 50% on every dollar that would be realized. As I said, that the most important aspect of it, and this has to be seen in perspective, is that the World Health Organization is entrusted and to a great extent is expected to achieve the Sustainable Development Goals. And if you want to see, what these things really represent, I can, take you to these Sustainable Development Goals, and typically you will find that there is really a situation where you would get a much better view of these things and how the goals are implemented. But let me go, I don't have much time. Maybe I will take this one things. The first one, it goes 1, 2, 3, 4, 5, 6, as you can see, no poverty. To improve health by improving the standard of living people, to improve also the capacity of billions of people to be out of hunger. So zero hunger is now a target. The third one is directly under the purview of WHO, which is good health and well-being. The improvement also of education so that people can, own the improvement of their health through better education and knowledge, and increasing gender equality, because quite a number of women in the world are the most vulnerable to disease, given the fact that they have no resources and their education is suppressed, and they are the group that would improve health overall, more so than any other group, given that they have been excluded. And then the target is to have clean water, as water and sanitation are umbilically connected, and that you cannot possibly have good health without having good water and clean water. The 11th one is sustainable cities and communities, that the city that is not devouring its resources, that is really able to bequeath to future generation a clean environment of the type that they receive, is also part of the fundamental objectives. And now is taking a responsibility, WHO, for climate action to create resilience and capacity of communities to adapt and to mitigate what would be the negative consequences from climate change. And the last two that is that peace and justice and strong institutions is now part and parcel of what constitutes resilience and the capacity of the world to mitigate the negative consequences of bad health. And as you know, that one of the major destroyer of life is strife, violence, and this would really be one of the most important ones. The last one is to create partnerships. And here, this is really one of the hallmarks of the WHO. It's partnered with every country health system and trying as much as possible to forge new collaborative effort, collective effort among countries, not only on individual basis, but on collective basis, so that there would be a concerted effort to increase the resilience of communities and their health capacities and the preventive methods rather than just focusing on palliative and different ways of dealing with disease. In a nutshell, WHO is an organization that has really achieved incredible results by saving human life due to disease, by increasing the resilience of people and communities, and by bringing nations to work together collaboratively and to reinforce and leverage partnerships to do that. I think I took more time than I intended to, but you know, just as a nutshell, this is WHO that we are trying to save from this concerted effort to undo some of the great achievements they have been able to achieve.
Okay, thank you very, very much, Ati, for laying out some of the big picture there about what the World Health Organization does, what some of these international institutions affiliated with the UN and other bodies are themselves doing, and some of the goals in general that people are aiming to achieve here. I like to have that kind of big picture thing at the beginning of a talk. I know people will get into more specific issues and controversies and interesting discussions. We had intended to initially introduce this event with a short introduction from Dr. Margaret Harris from the World Health Organization, who generously has been attempting to reach us overseas. And although there was a bit of a delay in getting a hold of her, I think we may be able to actually reach Dr. Harris after all. So I'm going to see, I believe it is possible to have the initial introduction that we want to have at this part in the talk with Dr. Margaret Harris. So before I do that, I'm going to provide a little bit of information about Dr. Harris. She's a public health physician specializing in emergency risk communication and evidence evaluation. And she's worked for the World Health Organization for the past 10 years, mostly in emergencies and outbreaks such as polio eradication, the West African Ebola outbreak, Zika, Ebola in the Democratic Republic of Congo, and now, of course, COVID-19. So we're extremely grateful that despite all the time differences and physical distance, we can have Dr. Margaret Harris providing an introduction to this section of the event. So let's go over to Dr. Margaret Harris now.
Thank you very much for that introduction, and thank you so much for the invitation to speak to you. I was particularly excited to address a group of economists because, to me, economics underpins everything we do. And quite often when I'm questioned by the media, there's this idea that it's health or the economy. And as ATIF has beautifully demonstrated, the two are inextricably intertwined. You cannot be successful managing health if you do not consider the economic consequences. And you cannot, and also the economy or economic issues, and you know this much better than me, will not advance if you do not have good health. When we look at children, for instance, who have parasitic diseases, they perform less well at school, they never reach their full potential. And so the societies where you have chronic malnutrition and chronic parasitic diseases simply can't go forward because they lose their human capital. So thank you so much for ATIF. You've really made my job easy because you've given such a beautiful overview, and it was the vagaries of Zoom that kept me away, but I'm so glad. I think maybe there's some magic working here that made you go first. So thank you very much for that. That was a great introduction. So I'll focus mostly on COVID, since I've been living and breathing it since the beginning of January, and what it has shown us about the importance of having a coordinating body like the WHO. And it was wonderful to be reminded of all the plans we put in place a couple of years ago to address the big problems. And one of them, as you could see, was health security. Now, we said protecting 1 billion. Actually, COVID has shown us that protecting health security is about protecting every human being on this planet. A health threat like COVID threatens us all, and again, threatens the entire world economy. We have found over and over again that unless we work together, our efforts will fail. So while there has, of course, been a lot of backlash against the World Health Organization, and some of it's understandable as people are struggling with something so difficult, it's very easy to look for a scapegoat. When you're struggling to find answers, quite often the easy way out is to blame someone else. But this is a very, very clear example of how we will only beat it if we work very well together, and if we all work in our particular areas of expertise and our particular specialties, and bring our best ideas to the table and have those ideas listened to. Throughout this outbreak, we started initially in January with simply reports of a cluster of of pneumonia of unknown origin. Now, because we are a global agency, and because we have access to expert networks, we very quickly had a lot of discussion, and it was pretty clear that this looked like it was a relative of the SARS virus that caused a major outbreak in southern China and spread to other countries, including Canada. But this was not confirmed, but already, because again, we had access to so many people, so committed, even though it was over Christmas, which is a very important period, holiday period for Western societies particularly. People rallied and came together, and within the first week, we'd already been able to put together some guidance about protecting yourself, particularly protecting healthcare workers from what we thought was potentially a very infectious respiratory disease. So therefore, we were able to advise people to protect themselves. And as a result of those networks, as a result of people working night and day pro bono, most of the people who provide most of the information and the help to an organization like WHO are not paid. They are putting their effort in, and they're paid by their institutions, of course, but they are not paid to work for WHO. This is what they give as part of the world community. By the middle of January, we knew what the genetic sequence of this virus was. We had indeed identified that it was a member of the coronavirus family, and we could put out the blueprint for the first tests. So the tests were developed by the middle of January, and then we could test more as widely as well as possible and get a much clearer idea of what sort of transmission was really going on. And as you know, by the end of January, by the middle of January, we called the Emergency Committee for the International Health Regulations together. They deliberated for a week, but by January 30, it was clear this was a world emergency. So we declared a public health emergency of international concern. Now, for all those things, you need a global coordinating agency. And yes, of course, we will be criticized over and over again. But as somebody said, if you didn't have the World Health Organization, you'd have to invent it. Now, there are lots of reviews going on at the moment, because what happened next in February was that many countries did not consider that warning we gave, the public health emergency of international concern, which is our highest level of warning. That's saying state of emergency for the world for an infectious hazard, but it wasn't seen that way by many, many countries. And some of that is down to economic factors. Getting ready for an outbreak like COVID means you have to invest in testing. You have to invest in people to do the testing. You have to invest in the laboratories. You have to invest in contact tracing. You have to invest in training. So you will be making a lot of financial decisions and human resources decisions in the belief that you have a major threat. Now, we were saying there's a major threat, but that was not necessarily how every country perceived it. We often struggle to get countries to really believe in preparedness. Preparedness is a bit like housework. You only notice that somebody isn't doing housework as well as possible when the house is looking a bit grotty. When it looks nice and normal, nobody notices that somebody has been working all day, every day to keep it like that. And preparedness is like that. You have to keep on maintaining sometimes teams, sometimes highly trained people, doing the training, having the equipment ready when there doesn't seem to be anything much happening, or at least having the systems in place or the means of doing it. And of course, again, that's where brilliant economic minds are very important. How can you do this without making it a drain on your system? How can you ensure that you are truly prepared for a threat without seeming to have wasted resources? It certainly is a fantastic investment. We found this with the Ebola outbreak in Democratic Republic of Congo. We were fighting this outbreak in Eastern Kivu, in the North Kivus in Eastern Democratic Republic of Congo, where they've had a war going on of various forms for the last 20 years. And there are more than 150 insurgent groups, some of them very, very vicious and violent. I was locked down for a week with a gun battle going on around me for a week, and we lost several members of our team who were shot and killed. All sorts of very, very violent conflicts going on all the time, and a very porous border. So we had a very large outbreak of a very dangerous pathogen, Ebola, the most dangerous we know, in the middle of a conflict. Uganda, which shares that border, and people on either side of Eastern DRC and Uganda are the same people. They go back and forth every day, had prepared. They had invested, they'd worked with us, they prepared. Some people did go over to Uganda wanting to use the health system, which is a strong and good health system. And they were immediately picked up because of the preparedness. So we had to spend a lot of money to fight that Ebola outbreak. It took 2 years. It would cost an enormous amount in human resources and other costs. Uganda didn't have to spent very little comparatively. So what they spent on preparedness was a drop in the ocean, and it returned massively in investment because they did not have ongoing transmission, they did not have an outbreak, and they were able to prevent any, and they were able to detect it very early. So that's where the world has not been paying enough attention. It happens in countries that have constant infectious hazard infectious threats. They are good at preparedness. This COVID outbreak has shown that the rest of us are not so good. We're good on paper, we're not so good in reality. So again, all the arguments about where you invest your money, what you do in your health system, how you repurpose your health system quickly, what is your health system for? Access to care has turned out to be critical in managing the COVID outbreak, where people could not get access to testing, where they could not get access to care. We have often seen, again, higher mortality rates, higher caseloads, higher disruption to the entire country. So once again, the arguments about how you structure your health system, how you make it available, genuinely available to all people, are critical for how you protect your people from a threat like COVID. I think I'll stop there now. I've really covered the areas that I wanted to, because I find with a forum like this, I'm actually a lot more useful when I listen to what you have to say and when I answer your questions than when I just lecture at you. So I'll stop there. and let you get on with the program. And I'm assuming we'll have a chance for you to ask any questions you want of me.
Wow, I'm certainly glad we were able to get a hold of you for the panel, Dr. Harris. That was very energetic and wonderful. I see some applause coming up among the participants and panelists. So that was a wonderful, spectacular overview of why the WHO exists and what it's trying to do. It's great to have it right from the source like that, and it will help inform what the other panelists are saying. Oh, look at all that applause coming all over the participant view there. So that's amazing, and I know that there's more specific issues to get into. I should make a reminder about time. I let Margaret go on a little bit longer than was expected because it was so interesting, but we do have to stick to our time frames here. So for example, there's going to be some further discussion of political and sociological implications of all of this, and we have just the right people to address that. I know Dr. Alan Freeman is scheduled to come up next, and he's probably the right person to follow up on this. So I'm going to turn it over to Hannah for a moment. She's going to introduce Alan Freeman.
Hi. So I'm happy to introduce our next speaker, Dr. Alan Freeman. He is a co-director of the Geopolitical Economy Research Group at the University of Manitoba. He was an economist for the Mayor of London, England between 2000 and 2011, during which he held the brief for the creative industries and the living wage. He has also co-authored 3 books on value theory and was a founding member of the UK-based Association for Heterodox Economics. He currently serves on the boards of Manitobans for the Arts and Winnipeg Video Pool. Thank you, Dr. Alan Freeman, for joining us, and you may begin your section.
Thank you. I'm really honored and pleased to be part of this discussion and grateful for Margaret's wonderful talk, which I found so illuminating. I'd like to try and share a screen, not talk to it, but have it as background. So am I allowed to do that? It looks as if I am. Okay, that's good. All I have to do is find it. So can everybody see that okay? Just, you know, if a couple of people say okay, then I'll know it's working. That looks good anyway. Maybe let me just make sure. Oh no, I can see it's not sharing it. Okay, now we're sharing, I hope, are we? Yeah, good. Okay, so I'm just going to begin with an unashamed plug for asking you to support Dimitri Lascaris in his bid to lead Canada's Green Party on a platform that encompasses everything I think we're trying to achieve here. To do that, if you're a party member, share and support the campaign. If you're not, join the Green Party before September the 3rd, a week away. And in the chat, I'm going to post a link to his site where you can find out more. And by the way, anybody can donate, no matter which country you're in, no matter which party you're in. Okay, plug over. I'm also going to post in the chat the full version of this paper. Now, I wrote this early in the pandemic because there were critics of China's lockdown, and I'm going to put scare quotes around that because I'm going to question the word lockdown, which came both from the right and the left. And they said that the West should not do the same because it would infringe civil liberties. They also said COVID was no worse than flu or even a fake. And lockdowns would strengthen the power of the state and it would take away fundamental rights like freedom of movement. Now, I think that's a very important argument that needs to be looked at and examined in much more detail. I'm not going to waste time on the first argument because if you see these data, they show clearly the US, the UK and Brazil lead the world in new deaths per million, while Sweden, which was being held up by naysayers as a relaxed alternative, is approaching Italian death levels. So I'm going to return to a more detailed discussion of the statistics if you want, but I am going to see if I can just move this on one because there's some critical things elsewhere. It doesn't look like I can. But what we've also got to look at is this famous case fatality ratio, which many people quite rightly said from the outset was not known until the pandemic was over, which is a bit of a problem because it's hard to estimate risk when you don't know the case fatality ratio or the R ratio. But I think what I would have shown if I could have moved my screen is that in fact the case fatality ratios in the key countries are bottoming out. They're asymptotically all tending to a level of about 3%. And you'll see there a calculation of how many have already died from COVID, which is way more than seasonal flu one of the things people say is seasonal flu is just as bad and so on. So let's not spend any more time on that argument. The second point I want to make to start this discussion on civil liberties is the most authoritarian responses, that is, reactions about general politics, coming in the countries that oppose lockdown. So Trump's America, Bolsonaro's Brazil are the places where you're seeing some of the most scary authoritarian developments in politics. The second point I want to work out is that forcing people to work, to go back to work in unsafe conditions, is also a suppression of civil rights. And labour organisations have fought for health and safety at work throughout their history and are quite rightly opposing simply being sent back to work while the pandemic is still operating. So, in no way do I claim that strong measures are not needed. I believe they were critical to China's success. And I think the catastrophic situation in the US and UK is largely because they refused such measures. But I think the word doesn't explain the differences between countries that had failed. I want to analyse the various strategies along two axes. The first is the choice between what I call what other people call herd immunity, and what I'm going to call minimum transmission strategies. And the second axis, not necessarily orthogonal, is between a social health and care system and a monetized system. Now, herd immunity, which was initially practiced by all Western countries and basically still is, essentially assumes everybody's going to get infected until the thing dies out, the R factor, when it gets to about 65%, or Professor Friston from the Independent SAGE group in the UK has come up with another estimate of 20%. It sinks below 1 and the pandemic dies out. Now, despite the flattening the curve, this idea was never abandoned. It only aimed to reduce pressure on the health system, not to stop people catching the virus. The aim was just to stop them all catching it at once. Minimum transmission aims to stop people being infected in the first place by preventing the carriers from, now I really do need to show this screen, so I'm going to stop the share, move it and reshare. Because I want to show you the deaths per million in the different provinces of China. So let me attempt to do that. Hope it works this time. Yeah, I'm doing that from my notes. And I hope you can see a table there which shows infections in Wuhan and in the province of Hubei and in the other provinces. And what you'll see is the infections in Hubei and in Wuhan were an order of magnitude higher than all the other provinces. That means the strategy cannot accurately describe the simply locking people down. There was a lockdown in Hubei, particularly in Wuhan, a very frightening one. But after that, the strategy was to stop people moving from one place to the other and carrying the virus with them. That's what I call a minimum transmission strategy. The aim is not to let everybody get it, but to get to a situation where nobody can get it and nobody can transmit it. So lockdowns, I think, are just an extreme case of minimum transition, in which people can't even enter the street if they might carry the virus. Now, that's the first dimension, and I think it's very important that people understand this. The second dimension is the type of health system. Now, there's a spectrum, but the astonishing thing is that some very poor countries have been very successful. And this isn't just, by the way, socialist countries like Cuba or Venezuela. For example, Senegal is an unheralded success. Margaret spoke of other African countries. And the lesson there is very important. They have a social health and care system. The least successful are those what I call a monetized system. Now, in a social system, both health and care, which includes the elderly, the infirm, children and families, is a universal right. That's free to every citizen. In the US health system, despite the huge size of the industry, healthcare is only available to people who afford it. Now, if you have a country that is beset with massive inequalities of wealth and income, and I'll just stop sharing now so you don't all try to read it ahead of me. This is a very important thing because it means that the great majority of the population have no protection, even though the society itself is very wealthy. A much poorer society that gives equal, free and universal protection and care to everybody at whatever level it can manage actually extends protection to more people. So I think these two facts shed a different light on civil rights and freedoms. What do we do? How do we determine whether a measure that is required for social and individual survival is suppressive? And the crucial thing that's missed out of most discourses is consent. In Canada and France, cars drive on the right. In India and Britain, they drive on the left. Is it a horrible infringement to ask a Canadian to drive on the left in India? No, it's obvious. People do it because it's reasonable and it makes them safer. If you're not threatened by confinement, if your livelihood is guaranteed, as it was in China, if a doctor will see you free of charge if you fall ill, free of charge, it's very different from being condemned to die in a hovel or a Quebec old person's home. The evidence is that countries with social health care, people consent to restrictions because they feel safer. So preventing entry is also very different from focusing on exit. All countries control entry, not least to private property. The question is entry to what? If you live in an infection-free country, a province, a city, a neighborhood, or an apartment, it makes complete sense to stop infected people coming into that area. So I'm going to conclude by turning to the role of WHO and why I think it's under attack. We live on one planet. Catastrophes do not carry passports. COVID will not be the last pandemic, nor necessarily the most fatal. We stand on the threshold of universal human catastrophes, and that's why a universal human response is required, as the first two speakers so eloquently explained. Now, I grew up during the last Cold War. I was in Berlin before the wall fell. I watched it fall. I stood between the two outer walls and recorded the sound of the hammers. I visited it many times after. I was in Russia before the USSR collapsed and after. And as we now stand on the verge of second, already in many senses, a hot war, Margaret's already talked about the conflict zones, which we find all over the planet now. Recall that the two big human enterprises that transcended the Iron Curtain were the peace movement and the health movement. I'm proud my great aunt, Dagmar Wilson, launched the first women's peace movement called Women's Strike for Peace in 1953. She left us a legacy from which everyone in this meeting has benefited. They stopped nuclear testing, perhaps the greatest potential source of mass pollution and damage to health known to mankind. But the second is collaboration on the health, which went on for the whole of the Cold War and chalked out remarkable successes like the elimination of smallpox, the near elimination of polio. Now, there's one ironic and significant difference. It's not the others who are putting up the Iron Curtain, we are. Trump's wall with Mexico is made in America, not in Russia, not in China. The desperate immigrants trying to breach Europe's invisible Schengen wall are being shot at by Europeans, not East German border guards. I think there's an obvious reason for this. The management of COVID by Donald Trump, Boris Johnson, and the likes of Bolsonaro has been an unmitigated disaster. The economic slowdown that this has catalyzed, because it was going on anyway, but it's made it far worse, is unprecedented. And a distraction is vital. That means, as always, war. In 1999, and some people might say the first casualty of war is truth. Health is perhaps the second. In 1989, as the walls were falling, all America and all Europe celebrated what they called a triumph for freedom. Now the walls are ours. They're our walls. Who will cheer for bringing them down? Thank you.
Thank you very much, Alan, for that thought-provoking discussion there. We might hear a little bit more from you and the others on those subjects in the scrum or question period. And by the way, on that subject, Daniel is here from the Canada Files, and at a later time, he will be beginning the question period section. There's going to be a special segment for the Canada Files. We're going to hear from the Canada Files at the beginning of the question period, and I'm excited to announce that. So moving to our next panelist, it looks like we have Ian Culbert. So I will put Hannah on the screen, and she's going to introduce Ian Culbert.
Hi, thank you so much for joining us today, Ian. I'll be introducing Ian now as our next speaker. Ian Culbert began his career in public health in 1990 when he joined the Canadian Public Health Association. He served in a number of different roles within the association since, including director-level positions in communications, business, and corporate development, as well as pragmatic work in HIV, hepatitis C, sexually transmitted infections, addictions, and social marketing. In 2013, he was appointed as the CPHA's executive director and has been serving in this position since. Thank you so much, Ian, and you may now have the floor.
Thank you very much, Hannah, and thank you very much for the invitation to be here today. Certainly the Canadian Public Health Association has a long-standing relationship with the World Health Organization and has been equally committed to its goals over the years. We were at the original Alma Ata conference, and which we called for primary health care reform, and have had a long, enjoyed an excellent working relationship with the WHO and its many sister agencies. There is a phrase that disease knows no borders, and goes without any explanation these days. You don't have to look into history books to see examples of this. You just have to look at any television report, or actually look out your front window and see what's not happening in our neighborhoods these days. And because disease knows no borders, it is why an international organization such as the World Health Organization is absolutely essential these days. Some people will look at the cost of and the contributions, the assessments that countries put forward to contribute to the work of the WHO. And it's interesting because sometimes numbers seem really big. Like Canada's two-year contribution is about $8.5 million. That's 11 cents per citizen per year. And when we think about the incredible role, that coordinating role that the World Health Organization plays, not only in times of crisis such as we're living today, but throughout all time, that's a very small price to pay to any organization that can help reduce the potential for the spread of disease and to improve the health and well-being of people around the world. As noted before, the WHO has made some remarkable contributions in advancing, in reducing, the prevalence of vaccine-preventable diseases worldwide. As noted before, we have the eradication of smallpox, the near eradication of polio, and quite honestly, I would say the only reason why polio hasn't been eradicated is because of armed conflicts around the world, limiting the ability of immunizers to reach the most vulnerable populations. And we've seen the reduction of TB and measles. Certainly measles has been eliminated, not eradicated, but eliminated in Canada. We don't have any domestic measles anymore, and all of our cases of measles are imported into the country. So underscores, once again, the importance of not only having vaccination programs in Canada, domestic programs, but also those global vaccination programs to keep all children and adults safe from those diseases. As mentioned before as well, this is the downside of being third or fourth speaker. A healthy world is a more prosperous world. And I'm going to share in the chat box just a link to a video that CPHA produced a couple of years ago that talks about the return on investment of some specific public health initiatives that might be interesting to participants today. We know that during the 20th century, life expectancy of North Americans and Canadians as well increased by about 25 years. And those added years are the result of public health interventions, such as those that the WHO champions, not the result of advancements in medical care or pharmaceuticals. So the reduction of smoking rates, the improvement in workplace health, workplace settings, the attention to cardiovascular disease, child and mother well-being. All of these are important public health initiatives that the World Health Organization is responsible for being a champion and leader of in countries all around the world. Also, as noted, the WHO is dramatically underfunded for the amount of work it does and its reach Many countries either cannot or do not make their contributions on a biannual basis, making it even more difficult. Certainly the US government is the largest contributor of about $419 million US, which is 16% of the budget. So when a rogue president of the United States says we're going to halt payments, that is tremendously harming to the WHO, especially during a global pandemic. It is, I would say, a crime at any point, but especially during this pandemic. The second largest funder is the Bill and Melinda Gates Foundation. And while we certainly appreciate the philanthropy of that foundation, it is, I think, a symptom of the times when the World Health Organization has to rely on organizations other than its member states for its funding, and could potentially be a slippery slope for this organization, as it is dependent, so dependent on the contributions from member states. When those member states don't stand up and do their responsibility, the responsible thing, they are fundamentally forced to look for other forms of funding. While the Bill and Melinda Gates, I'm not demonizing that foundation by any stretch of the imagination, but I would much rather have a global health organization supported by nation states that, though many of them are supported by some kind of democratic government, as opposed to either private foundations or private corporations that may have ulterior motives. Nation states are the members of the World Health Organization and dictate its direction. And that's both the greatest strength of the World Health Organization as well as one of its biggest challenges, because nation states do not always act in altruistic fashions. And we see that, or there's the potential that happened with the COVID-19 outbreak with China. Perhaps China wasn't as forthcoming as they could have been. I don't know. I do not have original evidence about this, but certainly that's the accusation. But what is the WHO to do? Call out a member state as lying to them? Well, then you have two countries that are going to pull their funding or not cooperate. I think that the overriding importance of mutual trust and collaboration is absolutely essential for the WHO. And so they have challenges to make that happen on a consistent basis. Member states need to do their part as well. Government of Canada needs to do its part. And we're not always holding up our end of the bargain. There is supposed to be a position for a medical doctor at the Canadian Embassy in China, so that there is someone who is sufficiently equipped to review data coming in from various sources and to provide that on the ground insight back to Canadian officials. Well, that position has been vacant for a number of years. The Global Public Health Information Network has for more than 2 decades been a sentinel reporting system that has been supported by the Government of Canada to use non-official documents and non-official sources of information to identify potential outbreaks in countries around the world. In fact, at one point, it was able to scan the internet, newspapers, television and radio articles, and has been able to identify potential outbreaks for the past 20 years. But according to reports in the Globe and Mail, the resources and the staff that were assigned to GFIN were reassigned to domestic activities over a year ago, and the network fundamentally went silent, and so was not active as the outbreak in Wuhan province was being reported, was not doing its job and not supporting the World Health Organization in that manner. So nation states have their responsibilities and have to live up to those responsibilities. I think we need as citizens to call on our officials to set aside political differences and to step back from nationalism and the xenophobia that is becoming a more prominent aspect of international discussions. We need to recommit to the common good, because as we've seen with COVID-19 more clearly than any other outbreak in recent years, when we are not collaborating, we're not working together, we are all suffering much more greatly. There is common work around the international health regulations, around universal health care. That is absolutely essential if we are going to continue to prosper as a species. The one phrase that I like to repeat is health should be a common global good, not a commodity. And certainly thinking of health as a commodity is not a very Canadian attitude. It's much more reflective of what we see south of our border. But there is always a movement afoot, even within Canada, to commoditize our health and privatize it. Of course, the WHO is about much more than infectious disease, and they have played an incredible leadership role in bringing the importance of the social determinants of health to the forefront and leading work on climate change. Of course, they're very closely connected, and as global warming continues, we are going to continue to see more global pandemics as urbanization encroaches upon the natural environment and the natural habitats of communities continue to shrink because of global warming. I'll end by saying that a quote of Winston Churchill I particularly enjoy that I think applies to the WHO is he said, democracy is the worst form of government except for all the others. And in the current situation with so many critics, you could say, well, the WHO is the worst possible global health organization except for all the others. I think the goal here is to work together to improve it, to strengthen it, to show it its support for it so that we can be a better a species worldwide. Certainly we have seen the blatant politicization of health and the scientific processes that are going on south of the border. And we need to have a strong global health voice that is the WHO to set a clear path for the future. And
Thank you very, very much, Ian. That was very encompassing, and I think your points are well taken. So I think we're going to be closing out the panel part of this discussion because we have our final speaker of the panel segment, and that's going to be Dr. Alan Whiteside. And so I'm going to move over to Hannah, and she's going to introduce Alan.
Thank you so much. I'm happy to introduce our final speaker, Dr. Alan Whiteside. He is the CIGI Chair in Global Health Policy at the Balsillie School of International Affairs and Wilfrid Laurier University. He was previously a director and professor of the Health Economics and HIV/AIDS Research Division at the University of KwaZulu-Natal in Durban, and he's been extensively involved in HIV/AIDS research for over 20 years. The spread of COVID-19 is currently a major concern of his. So without further ado, you may begin, Alan. Thank you.
Good. Thank you very much indeed. Well, there's an advantage to going last because I can respond to some of the previous speakers. So the first thing I must say is that I don't want anyone to go away with the idea that we don't have social health in England. We do. It's called the National Health Service. It may be creaking, but it's not too bad. The second thing is that I'm afraid economists do rule. I'm one, and I know it. But then on the other hand, we tend to know the price of everything and the value of nothing. So it's really up to the rest of you to put us right on that sort of thing. And then the third thing I'm going to say is that the title of this is Countering Hostility to the WHO. a bit like sitting at a meeting of a particular group of people where I have to say, yes, I was hostile to the WHO for quite some years, and there was a very good reason for it. In 1994, as the AIDS epidemic spread across Southern Africa particularly, we looked to the WHO for leadership, but instead of getting it, the then Director General of the organization, Hiroshi Nakajima, silenced Jonathan Mann, and as a result, the organization that is called UNAIDS was established because the WHO was completely inadequate to the task of battling HIV and AIDS. I think they've learned then. I still don't feel that the COVID response is adequate, and we've still got a lot further to go. But on the other hand, COVID is a new disease. We'd never seen it before, so we're all learning as we're doing. Right, so a few points then, and just a few points. The WHO has the vision of a world in which all people attain the highest possible level of health, and a mission to promote health and keep the world safe and serve the vulnerable. Now, by the way, I do think that when we talk about health and saving lives, I don't think we should. I think we should be talking about postponing deaths, because we never save lives forever. We are postponing deaths, and our challenge is to make sure that the interim between now and that point is as productive and healthy and as fulfilling as possible. So there's a little thing for us to debate. Are we talking about saving lives or postponing deaths? I think the WHO has a few problems, and I want to turn to those for a minute. We talked, someone earlier spoke about the fact that the US was the biggest funder, providing 15% of the budget. The second largest is the Bill and Melinda Gates Foundation, which is 9.8%, and that's followed by the UK. And then if you look at the table of the funders, what you see is that national governments, by and large, don't even feature on this. You can pull this off the WHO website. So why is there hostility to the WHO? I think that it's being led by the USA with Donald Trump's statement in May that he was withdrawing. He's in the process of defunding and taking the USA out, a real problem because 15% of the budget came from them. But at the moment, it's mainly Trump. I think there's a real danger of blood in the water, and that could be disastrous because you get all sorts of other institutions attacking the organization and given some credibility because of Trump's position. Why did he do it? Well, he said that it was because of the level of influence of China on the WHO governance. And we have to understand that that was a pure distraction in the context of the emergence and the spread of COVID. On the 15th of January, there were just 69,000 cases in the world, and the USA had 43, 0.06%. By the end of May, there were 6 million cases, and the USA had 30% of them. Today, there are about 24 million cases, and the USA has a quarter of them. The withdrawal announcement came during a period of denial and lack of health leadership domestically. And of course, it's a classic distraction. Play the man and not the ball. And that way you can try and get away with things. There's also a degree of fear. We don't know enough about this disease to deal with it. And this is a clear reaction, as somebody else mentioned earlier. And then, of course, and I don't know if this is a term that you know in Canada, there's what I would call the Black Helicopter Brigade, who are hovering around and making things a little bit more dubious. Now, I do think there's some issues about who's funding it. And I do think that obviously having the Bill and Melinda Gates Foundation becoming the largest donor to the WHO is a concern if they're assumed to have an agenda and to have undue influence. But I don't think the answer is to reduce their contribution. It's rather to raise others and to diversify the funding. There's an anti-vaccination lobby, which I personally don't understand, which attacks the WHO. And I have very real reason to be concerned about this because in 1961 as a child, I had measles, which developed into encephalitis, and my life was actually in balance for a while and was saved by a rather good mission hospital in Swaziland. 3 years later, I would have been vaccinated. I wouldn't have had that problem. So I do think that the role of the WHO in health protection is absolutely critical. And of course, in the last few days, we've had reason to celebrate with the eradication of wild polio in Africa. And as was said, if it can be eradicated in Pakistan and Afghanistan, then it too will go the way of smallpox. So, is the WHO fit for purpose? Well, as somebody also said, if we didn't have it, we'd need to create it. It was Voltaire who said, if God did not exist, it would be necessary to invent him, or her, of course. And the same is true of the WHO. It has critical functions for international health and setting standards. But I do think we need to remind ourselves that WHO is not just about curative medicine, it's about preventive medicine, and we need to think about the social determinants of health. Now, I think we also need to be aware that there's a general hostility to international organizations, and we can see that in the decline in overseas development assistance. I'm sitting in Norwich in the UK, and the government here, Boris Johnson's government, and I'm not fond of Boris Johnson, let me say, stated that they were going to continue to provide 0.7% of GNI in international development assistance. The unfortunate reality is that GNI has just fallen by between 10 and 20%. So development assistance is going to follow in the same way. And the UK is generous. Canada, 0.25% of GNI. The USA, 0.15, but who'd be surprised by that? And the most generous is Sweden at 1.36%. So what are the lessons for WHO? Well, I think they're even more important now because of Trump than they were before. The disease detectives, in my opinion, were the CDC. Now we're going to need the WHO to step into even more breaches than they were before. We need to talk about what we don't know. And I have to say WHO is not very good at that. But you need to be saying what we don't know and bringing people on board to try and work out how to find out the information. We need better communication and more transparency. And I'm sorry, but the WHO is one terrible bureaucracy, but then so is every UN agency. And that is something where we need to move forward. And that means becoming a nimble, fast-moving organization. What can you do? Well, in most countries, there are United Nations associations, and they are really quite remarkable groups of unassuming and unrecognized people who are trying to influence the UN. And I just want to finish with a quick anecdote. And that is that Canadians, as we say in England, punch above their weight in international health. When I set up HERD, I was funded by mainly European donors. And I suddenly found that I had a problem because I had money, but no staff. I had a friend working at the London School of Economics, Tony Barnett, some of you may know his name. And I went to him and I said, Tony, I've got a real problem. I've got pots of money and I haven't got people to come and work with me and for me. So we set up the London School of Economics and Health Economics and HIV/AIDS Research Division internship program. Do you know, every one of the first 8 people I got from the LSE was a Canadian. People like Hannah coming to work in Durban. And that, and the fact that I now came over to Waterloo, indicates that I do believe Canada has a really important role in international health. Let's find ways to move forward together. Thank you.
Spectacular. Thank you, Alan, all Alans, and Ian and ATIF. What an incredibly competent panel we have. Alan, thanks for your impassioned speech. And I like that you added a personal touch. Of course, there are personal reasons for all of us to be involved in this discussion. And thank you, Ian, for actually providing a link exactly when you said a link was about to be provided. And there it popped up in the comments. You can check that out in the group chat. We'll be referring to that shortly because there is a comment section. There's going to be some questions and whatnot, and the opportunity to take those questions. But before we do that, we're going to have a short scrum between the panelists. It was originally going to be ending in a few minutes, but it's going to be 15 minutes. We'll make it about 10, I think, and I'll activate our panelists if they want to respond to one another and respond to what they had said earlier and take on some of these issues. Since Margaret Harris was so generous to actually stay with us this whole time, we weren't sure that would be possible, but she's here. So I might allow Dr. Harris to go first if she likes, if she wants to respond to what the other panelists have said, and I'll be unmuting them and opening them up as well.
Well, thank you very much. I have learned a great deal, and I appreciate the comments, and I am aware of the issues around HIV and the creation of UNAIDS. I think all crises and failings and it lead to new creations of things, and certainly criticism and request for change is a positive thing, as long as it's criticism for creation of something better rather than criticism for criticism's sake, or as you mentioned, for distraction's sake. But very much appreciated all the things that have been said. I've learned a lot. I would agree entirely that WHO, like all UN organizations, could do with being a lot less bureaucratic. And I did like the point that we should say more about what we don't know. It's a tenet of good risk communication that you state what you don't know and what you're doing about it. So I will bring that back to the people I work with, because I very much agree with that. Thanks.
Thanks so much, Margaret. It looks like some thumbs up there. That's great. And if any of the other panelists want to respond to that, you can unmute yourselves or respond in any way. We have a few minutes in which panelists might be able to discuss some of these issues and thoughts and reactions with one another. Some of you are already unmuted. In fact, if you wanted to go ahead. Atif, I think you were raising your hand.
Yes, I was. I very much enjoyed the discussion. This is really far beyond what I had expected, and I'm very happy about that. I'm going to talk from my personal experience. I ran a UN regional agency, and one of the most important contributions a UN agency contributes is the convening power. There is nothing in existence that is able to provide a table to which it can invite so many countries to come together to do and to forge or to create a collective response to things. In the absence of the UN, there is nothing. The other concept that I like to really talk about is that, yes, economics is very important, and we should really, take the economic impacts and discuss resources that would be required and what would be the ratio of cost to benefit. One thing we do wrong in economics is we try to put a value on human life. This is really where we go wrong. All right, they say implicitly it is this number and that number. The story here is that one life is so important that it's not going to be the dollar value. If anything that WHO has contributed is the saving of lives. And to me, this is a value that you cannot put in dollars. And if it has done nothing, that contribution, that number of 30 million people lives have really been saved is incredible. Today with 178,000 people dead in the US, my God, these lives could have been saved if some of the measures that WHO had recommended had taken place or had been implemented. So the story here is not about economics, about willpower, about political foresight, about leadership, about the capacity of the world to act in a meaningful scientific way, accepting facts. Far more important than economics are facts. And this is something that is now, in my view, the scarcest commodity.
Thank you very much, ATIF. And wow, people are keeping it short. That's amazing. And I think Alan, he had something to add as well.
I'm going to disagree with Atif. I think economics actually, at the end of the day, is fundamental, because we don't do anything for nothing, I'm afraid, and that's the reality. We have to have the money in order to do things. And if economics wasn't important, Margaret's organization would be properly funded.
But you said, Alan, and that's very important, is that we know the price of everything, the value of nothing. The question is not about having money. What value, what bang are we getting for every dollar? And to the extent that we have depreciated and have underestimated the value of life, I think is a very critical shortage of economics.
Yes, okay, I think there's a bigger discussion to take at another point. By the way, the other thing that I would like to say is that when we look at what COVID is doing, the number of deaths may be quite small, but the impact on people's lives is immense. And the collateral damage in terms of people not getting to doctors, not getting food, economies disrupted, is so large that I really think it is an economic and a health catastrophe and a humanitarian catastrophe for the world.
Yeah, I was part of a discussion and had commented on a report that came from the University of Toronto and a few universities, in which how do we open the economy? At what cost is opening the economy? And what I found there is that, yes, the economic situation is dire, and there are really costs to that economic lockdown, and that there are going to be huge pain exacted on others. What I found missing is the ability to try to somehow factor in the value of some impacts on life. Okay, I tell you, say, all right, you open the economy only to the extent that there is capacity in the health system, there are ventilators available, there is ICU units. The trouble is not anymore the ICU units being there. I found out that most people are above age 80, they go there, 80% never come back. So it's not the issue that we have ventilators and that we're going to deal. No, the issue is how many people are dying. Why isn't this a very important criterion to take into account?
Okay, well, thanks very much. You know, that kind of discussion moves into the exact things that would be asked during a question period. And those are the kind of things that are starting to pop up, questions of that nature. So we're going to be moving over to that very shortly. And actually, to begin the question period, yes, we have a special comment from Daniel, and Daniel is from the Canada Files. He's the official representative, in fact, of the Canada Files. And as the media sponsor for this event, we're going to have a special commentary, special question from Daniel, who'll be able to essentially get the question period going, at which point I will further explain how people can participate. But before I do that, yes, let's go over to what Daniel has to say. I'll put him on the screen.
So this is a very insightful presentation. I didn't know about the achievements of the World Health Organization's aims, and seeing this, I'm looking at what's going on in American society and their response to like vaccination and the social market. It's also sickening. There's a lot of figures in American politics usually on the right, but even in some cases on the left, that basically think that vaccines are evil and they're all a plan to take over the world, rather than something that could, rather than agree with WHO regulations or the need to provide to provide for their people. They see things, a lot of these politicians and figures, they see things too short-sightedly, only looking at profits or trying to get an ideological point across, rather than seeing what benefits the people and the economy in the long run. So on to my question. During his campaign and during his presidency, Trump has hinted that he views China, well, he has always stated that he views China as a major threat for the US to deal with. And I'm wondering if the current policies he has taken, basically fomenting backlash against the WHO, has much to do with his attempt to start a new Cold War against, or rather more succinctly, escalate existing tensions against China and use the suffering from the COVID as a pretext to divide the world and turn many of America's allies against China. I am wondering if any of you speakers believe that this might have been a sort of driving motive behind Trump administration's goals with regards to leaving the WTO, in that he wants to engineer a situation causing most of the world to just walk out of the WTO using his nationalistic rhetoric that China is influencing the WTO, that this should be called the Kung Fu virus or the Wuhan virus, and trying to engineer some sort of split between China and the rest of the world.
Okay, so big question, several aspects to it, I think. And it seems like the kind of thing at least some of our panelists probably would like to hear, say something about or have an opinion on. So I'll unmute anyone who wants to go up. I think most of you are ready to go. Oh,
I've been unmuted so I'm sorry, I missed a lot of the discussion. Quite ironically, because in this house, my partner is very busy engaged in developing a platform for Dmitry Lascaris's campaign, which takes up a lot of internet space, and that interfered, so I missed a lot, but I hope it will be beneficial. I gather that there have been a number of issues discussed, in particular the issue of multilateralism and economics, and that's what I'm going to try and address. And if I miss something, people can say, what do you think of that? So I actually think that I completely agree with Daniel's share. The critical motive behind what Trump is doing is not just to break with who, it's to break with multilateralism and launch a new Cold War against China. And the reason for this is totally clear, in my opinion. The government's handling of COVID has been a complete and utter disaster. Complete and utter. It is the world's worst performer by the world's nearly wealthiest nation. And it shows up the presidency and actually the American system in a very bad light. Now, this is combined with this massive revolt caused by the murder, and I use that word advisedly, of George Floyd. And a massive shift in popular consciousness in the United States to a situation where a great majority of people now support Black Lives Matter. This is, in my opinion, a working class revolt. I think there's a lot of confusion about it. They think it's a matter of identity politics and so on. No, it's a working class revolt in which the murder of George Floyd was the catalyst. And I think neither the Republican nor, unfortunately, the Democratic leaderships welcome this, because it means that politics in the United States is out of control. That's the reality. And so therefore, a massive distraction is necessary, in which I have to say one cannot simply blame Donald Trump, because you only have to read the Washington Post and the New York Times and listen to the Democratic National Caucus's pronouncements to see that they're hot on the heels of Donald Trump in endorsing Bash China. And that's why I made the remarks I made at the end of my speech about who's now putting up the walls. It's not the Russians, it's not the Chinese, it's us. As the famous Pogo character says, you may remember or not, when he was in the swamp and he first recorded about the dangers of pollution, and he says, I've seen the enemy and he is us. So we have to do something about it. Now, what can we do? Well, the reconstitution of who is very simple. It requires multilateralism. It's states, it's governments that have, what's needed is a place where governments collaborate. They may collaborate badly, they may produce bad results, but at least then they have an input into it. And via that, insofar as these governments have some accountability to their civilized, so their people, the peoples of those countries have an input into how it's run. There's no way out of that. There's nothing you can substitute for it. You can't substitute Biden or Trump for the WHO. You have to have multilateral forms of government, and that's what's under attack for reasons beyond just the WHO. So that's the first point. On economics, I think that, I mean, I've been a lifelong opponent of economics. I think it's fundamentally a religious enterprise, and that's what I've dedicated my time with the Association of Heterodox Economists and the World Economics Association to establishing. It's so out of touch with what's going on in the world, the economics profession. At least its hierarchy is, you know, I don't know if you know this, but half the economics profession in the world actually belongs to a dissident organization called the World Economics Organization, with 13,000 members, right? So I'm talking about the hierarchy, I'm talking about the discipline. It's completely and utterly out of touch with reality. And this is why you get student revolts in places like the London School of Economics, in places like Edinburgh, in places like Manchester in the UK, and in France. That's why. However, and one of the consequences of this is a very important critique, which is emerging from the ranks of green economics and green economists, who are beginning to criticize the motive of growth. Now, I think that what they mean by the motive of growth is the motive of material consumption, which is depleting the resources of the planet, creating the conditions for zoonotic viruses, everything that we see. However, I think it's very important not to confuse that economics with money. You're going to need money, whatever you do. And you're going to need the state to invest massively in reconstituting the health service, and I'll come back to the health service in a bit. You're going to need it to construct a completely new kind of technology based on renewable resources that doesn't consume material resources. That's needed, a complete overhaul, and that requires money. There's no way you can do it without money. But money is not the same as growth, money is not the same as material consumption, and money is not the same as what, unfortunately, most economists talk about, which is one of the issues we're going to be looking at when we look at the economic platform of Dimitri's campaign, which I played a large part, not the only part at all, in drafting. So I think I would say don't confuse economics with money. We need money, we don't need economics. It's my sort of quick take on it. Or you need a very different economics than what we've got now, which is something I do try and contribute to political economy. I just want to say a couple of things in response to Alan Whiteside. I was very careful to say a social health and care system. The two go together, you can't separate them. So I understand your point about the health service. And by the way, you know, I'm a great fan of the independent SAGE group, which has taken a sterling initiative in creating a forum for discussion of health by the British people, which is wonderful. The problem is this, that in China, if you were sent to quarantine, you would be supported. You had enough money that you could live. You would have food delivered to your door. You would be, if you had to go into hospital, guaranteed that your livelihood would be supported all the time that you're in hospital. You wouldn't basically be at risk of death by other means if you participated in the process. That's what led to the social consent. So it's the social health and the care system. And I think that's what's lacking in Britain. And in Canada, where actually in many senses, I think the health system is in better shape than in the UK, you have the parallel tragedies that are taking place in old people's homes in places like Montreal and other places, which is caused by the monetization of care. If you place the care of the elderly, the care of children, the care of sick people into the hands of people whose motive is money, even if they're good people, then that is going to place it at risk. And that's what's happened, because it became a cash cow. It became a cash cow for in which the most vulnerable people in the population were placed at risk. And of course you get these tragedies. So you need to actually take the whole care system inside the health system. And that's what I think is lacking in the UK and US. Now, finally, on this issue of I really love your point. You know, it's not about how you die, it's when you die. It's not about whether you die, but when you die. It's also about how you die. And I want to just give a tribute to a wonderful woman that I worked with when I worked for Ken Livingstone at the Greater London Authority. Well, didn't work with her, had a lot of contact with her. That's Anita Charlesworth. Anita Charlesworth, the chief economist with the health department. She was then with the DCMS. She's now with that Nuffield Foundation, I still believe. And she drove through the health evaluation system in the UK, the notion of quality-driven adjusted life years. I think that's fundamental. We need indicators of well-being, which include environmental indicators as well. And these should be the real drivers of our economic motives. In Dimitri's economic platform, we propose that we should be a series of plans for resource use, plans for healthcare, in which the indicators are not growth indicators. You need money to realize them, but the indicators that you use, that you target, will be indicators of well-being, including the well-being of the environment. So, sorry to take up so much of your time, but that's my quick take on all of that.
Okay, well, thank you, Alan. I know you had to go away for a bit, so I guess it's good to hear back from you and compensate for that a bit. I guess there's a surprising amount of debate over the nature and utility of economics among our panelists, which I find
just quite justified in my opinion.
Right. Well, you can't talk about health without it, I guess. Now,
the
I'm
more
going to have
people attack economics, the better the chances of us about saving this planet.
Oh, now you've upset ATIF. You've upset Dr. KUBURSI, and he's leaving. I'm going to have to ask for the indulgence of our panelists and audience a little bit. I was planning to end at this time normally, but I'm willing to extend it by 10, 12, 15 minutes or so, just to take care of a couple of extra questions. There have been some people raising their hands and asking questions, and if we can be short in answering their questions and succinct, then we can maybe get through 1, 2, 3 questions. There had been, for example, Ian Graham, who had been asking questions throughout the panel. He kind of got in first there, and he had a short question. It was just typed out recently. He said, how is the World Health Organization able to make the population versus carrying capacity of the planet a public discussion so we can avoid unnecessary death and suffering? Would anyone like to answer that?
Could I chip in on that? That's such an interesting question. One which exercises all of us a lot. And I do think that it's not just about carrying capacity, because the Institute for Health Economics, Health Metrics and IHME, Institute for Health Metrics and Evaluation in Seattle, is producing data that suggests that the population of the world will peak in about 20, 30, 40 years time, and then will start declining. So it's, again, to come back to what Alan Freeman was saying, it's not just about the numbers, it's about the quality that we need to consider. And that's really critical. And just to correct you on one thing, the World Economic Forum doesn't have individual membership. It's corporate memberships. So it's not individuals who are going up to Davos and pissing on the rest of the world. It's corporates.
Okay, thank you. That's a good answer. I think it takes care of it. We have a spicy question here from Marajalina Repo. She was asking the panelists, what is the cost of the global lockdown in the lives of all those under it in comparison to the cost of the virus itself, and cost not merely in dollars, but in other losses as well? Does anyone want to take that?
Well, I can pick up on that. I mean, that's exactly what I'm trying to say about social consent. I think that if you look at the verdict of the people of China, and I have many contacts with people in China, I'm regularly involved in academic and other exchanges, that the overwhelming feeling is that it was worth it. Absolutely worth it. But of course, it depends if you do it right. If you do it wrong, there's going to be a cost. But the cost is not the cost of lockdown. The cost is not the cost of trying to prevent people catching the virus who don't have to catch it, which is what lockdown is about. The cost is the cost of doing it wrong, or the cost of not doing it. And the thing about evaluating costs is very difficult in economics. The cost of being constrained against your will is high. But the cost of consenting to a measure that advances your livelihood and those of your family for the whole life for your whole life and their whole lives, even though the experience itself might be briefly uncomfortable, the cost of that is not high. And that's why, and we have Chinese students who stayed with us. And this, after the pandemic got underway, they said we want to go back to China. We don't trust Canada. We feel more comfortable, happier going back to China with lockdown and quarantine and everything. And I think that would be my verdict.
Just one quick point. If anybody reads The Lancet, and I'm sure you do, Margaret, it's really quite telling that in Spain, it's estimated, according to their surveys, that only 5% of the population has had COVID. So ideas of herd immunity seem to be going out the window, unless you get it at a very much lower percentage than we believed otherwise. What do you think, Margaret?
Yes, I agree. We're seeing at most sort of 20% antibody positive in cities that have had large outbreaks like New York. So the idea of herd immunity is problematic in lots of ways, because it was also this idea that you would just let it wash through and you would accept we were looking at, say, a 1% death rate initially, we were looking at the China figures, but that was already an enormous number of people that if you followed a herd immunity to its logical conclusion, you were expecting to lose at least 1% of your population. And as people in health, I really like the point you made about it's not lives saved, it's death postponed, or death postponed, or life lived to the fullest, and premature prevention of premature death, really. And I think we need to find a way to express that. That is really great. I've always been a bit frustrated with this idea of, we saved all these lives. We never save life totally, because we all do die. That's the one thing certain in life. Oh, taxes, that's the other one. Yes. But yes, the idea of herd immunity, I think, came up because it sounded so sciencey. I don't think it was well understood. Herd immunity is a concept from the vaccination world. When you're looking at the behavior of a particular virus, and you're looking at it, when you have a vaccine, what percentage of people do you need to have demonstrable immunity? And when you've got a vaccine, once you've got it through phase 3, you know that the immunity levels you've tested in phase 2 actually work when you're exposed to the virus. Natural immunity is an entirely different matter. And with this coronavirus, we are seeing that we do not understand the extent of natural immunity at all. We do not know how long people will be immune for. We've now got some documented cases of reinfection. So to come up with a concept of herd immunity when you had no information whatsoever about natural immunity made it an illogical position from the beginning, apart from the moral issues of letting a good percentage of your population die. I also like what you said about social care. We have really been pushing the health and social care workforce. It's not, you don't have health without social care, for one thing. And social care workers are absolutely essential to the health, mentally and physical of your society. You've got, if you're not investing in your social care workforce, you're not investing in the quality and the very best health of your society. And before this outbreak, we estimated that there was a deficit of something like 18 million health and social care workers, essentially because governments aren't keen on paying people. That's a recurrent expenditure. Health and social care, you've got, what, 80% of costs are your human resources costs. So if you're genuine about running an effective health and social care system, you've got to be genuine about paying the people who do it. That's enough from me, I think.
Right. I think that question has been answered quite thoroughly. We only have time for a couple. To combine two of them into one quick one, there is a question about political will. Nino Paglicia asked about political will. What is the importance of political will? Because he was in Cuba and saw many things done regarding healthcare as a researcher there. So I was wondering, first of all, what can you tell us about the role of political will in the manifestation of public health? And there was a related question by Fiona McMurran, who said, all these high-level discussions are nice, but if you can't make the case to the decision makers, then what is the point, and what is going to influence government? So panelists are welcome to take on that issue. I know Ian has to go almost immediately. You can say a few words before you go if you like on that, Ian Culbert.
Sure, thanks very much. Comes back to economics to a certain extent. Outbreaks like this cost national governments a huge amount of money, whereas the preparation is actually a very small cost in comparison. The challenge becomes is such as the National Emergency Stockpile in Canada. It was ignored. It was seen as an expense, a waste of money, because those that stockpile resources weren't being used, and so what fell into disrepair. The price that we're paying as a result is 10 times over what the cost of maintaining that is. Political support also comes in the form of talking to candidates on your doorstep, writing to politicians, being actively involved in supporting the United Nations Association of Canada in Canada. It's putting your effort and energy where you feel it is most important, can do the most good. Politicians respond to what they hear. And so if you're talking about it to them, it becomes important to them. And my apologies, but I do have to leave. It's been great talking with you this afternoon, and I hope you continue to have a great conversation.
Thank you. Thank you so much, Ian, and thanks for being flexible. We really appreciate that. Oh, some applause from the audience. That's great. Thanks, guys. Yes, so Ian, I understand you have to go, but I really appreciated that you could give us that extra 10, 15 minutes, and our audience certainly appreciated that as well. And yes, we are coming very much to the close of the meeting and what is going on, but a couple, if we can fit in one or two. I know Miguel just asked a question about multilateralism. He said there's this broad attack on it that we've referred to, and on the UN Charter and law. Pompeo talked about an alliance of democracies. He might be talking about an alternative to the United Nations. Is that something that is happening or to be concerned about, perhaps?
I don't want to say anything because I was the one who raised it.
Well, okay, maybe it's the ground has been covered a little bit already. Henry Evans, Ten Brink, has had his hand up for a while, and he said, it seems to me that much focus has been put on death and economics. What about the long-term effects of COVID?
Well, the thing about this is it's very new and we really don't know. I tried to look at parallels with HIV and AIDS. The thing about HIV is once you're HIV positive, that's it for the rest of your life. And you probably will need treatment at some point in your life. With COVID, you do recover. And so I don't know, I've had to rethink some of the basic epidemiology and economics that I carried over from HIV and AIDS. I do think that the good news is that you can get better. Most people will get better. The bad news is we haven't seen anything like this for decades. I sort of feel, Margaret, you need to say something.
All right, I'll jump in. Yeah, but exactly this. We don't know what the long-term effects are, but we are seeing an increasingly large group of people who are genuinely suffering continuing symptoms, particularly fatigue, breathlessness, and some people have really are so fatigued they can't get out of bed, and it's life-changing for them. Now, we don't know how long this will last. We don't know what exactly are the manifestations, so you have to look physiologically at what's going on and compare it with the symptoms. But certainly this is why we are saying, do not think this is something that it's fine to get because you're young and The first sort of messaging was if you were young, it wasn't a problem. It was just something for old people. And, you know, we even heard very early on in the outbreak, I think in February, senior officials in some countries saying, oh, well, it will clean out, you know, some sections of the population. It was quite extraordinary. And you did certainly hear from younger people, well, you know, it's them, those old people. It's not really a problem for us. But unfortunately, we are seeing younger people who never went to hospital, who never had what was classified as a severe illness, who are now suffering very much with chronic symptoms, particularly of fatigue, but breathlessness and other things that have changed how they live. And this may indeed, if we have very large numbers of people with a chronic form or what people are now calling long COVID, this will have enormous economic impacts, social impacts, impacts on how we work, how we live. Because again, ideally, we should not get infected. So then we have to change how we live our lives. Somebody described it well as learning to dance with COVID. And I think we do have to learn to dance with COVID, but it will be at arm's length, the dance we have with COVID.
Yes, and I think
I just
that
wanted to
is...
ask the epidemiologists a very quick question because of some studies being done by collaborators of ours here in Manitoba, which are rather interesting. The suggestion is it isn't just old people who get it, it's young people. And that what young people get is not the same as what old people get. It's a cytokine storm. And the argument, which is based on statistical analysis of reinfections, is that the reinfections of young people seem to take place in large events at which, you know, super spreader events, at which a fine mist is released into the atmosphere, like people sort of shouting and singing, that kind of thing. This is then absorbed deep into the lungs. And that provokes an immune reaction which overcomes the body's other mechanisms. Now, I have as yet no confirmation or disconfirmation of that, but it is a statistical fact that there's a definite spike of death and infection from COVID among young people. So I think we've got to be very careful about this whole notion that it's an old person's disease and they've had their lives anyway. No, these people, and if they survive, their lives are going to be blighted. And, you know, that's horrible. So I'll just throw that in. But I'm not a doctor, so I bow to you with the same reverence that you've wrongly offered the economists.
What I was saying exactly that. Yeah, and we're also seeing an increasing infection among young people because it seems that young people did not see this as a serious threat for them. So particularly in Europe, we are seeing lots of summer parties, lots and lots of the main driver now of the outbreaks in Europe is mass gatherings with young people. And you're quite right. There are deaths among young people who did not have underlying disease. But what I was saying was the initial idea, or the initial belief was that it's, you know, it for young people did not seem to feel that it was a problem for them. They felt that we old people were making a big deal about it because we were under threat.
I want to get back a little bit to the political will. I mean, one thing this COVID has exposed and, let's say, uncovered is that what's the difference between one political will and another? I mean, the quality of political will. There is lots of political will, but political will in the US was totally different than the one in South Korea or the one in New Zealand. It's the quality of this political will. Instead of obfuscating facts or going against science or creating certain alternatives that did not have any validity. The issue, most countries have come to the table with social programs, economic programs, but the story ultimately became, what's the quality of this political leadership? What's the quality of this political will? In what way it worked? How does it really deal effectively with this? There is a hell of a difference between one political will and another. It's the quality that counts at the end.
I think one more of the panelists had something to say, unless ATIF already took care of what I think ATIF may have already answered the question. Well, I think these are very wise words to end on, to hear from Margaret and ATIF and Alan about the health specifics of this and the dangers that are being faced and why we need to take better and more concerted action against this problem. I think it's a very important and very good way to close out on the panel. I regret we couldn't take the question about animal agriculture as it was just mentioned. Unless, do we have 30 seconds? There's a question about animal agriculture and how it affects pandemics. And certainly that has been discussed as a cause of the issue. Before I give the final closing words, does anyone have anything to say about the issue of animal agriculture as a potential cause of these pandemics or an issue that had to be addressed?
Well, I would just say we certainly are seeing increasing spillovers from the animal kingdom to the humans, and it's not purely agriculture, it's also because we are encroaching on the natural environment. So we are giving animals and the viruses circulating in them less, we are disturbing that balance and coming in, and we have seen an increasing number of jumps. I haven't got the numbers in front of me, but the acceleration in spillover from the animal kingdom to humans has been extraordinary. And indeed, any kind of work to stop pandemics in future must be highly respectful of the environment and the animal kingdom. If we just look at human health, we're going to miss the boat.
Yes, these things are very closely connected, and we need to hear more about that. So I'm glad that got brought up and got right to the WHO there. So thank you there. And it looks like we were able to take care of the vast majority of questions. So thank you very much, panelists, for your patience. Thank you, Alan, Atif, Margaret, and also Ian, who had to leave after 2:45, but was able to stay beyond the measure there. So I appreciate the audience was there not only until 2:30, but many of you stuck around all the way until now, which you didn't have to do, but we really appreciate it, and that we're able to offer you answers to all of these questions. So, thanks to our own executive and Doug and Hannah for the introductions and for researching the introductions for our guests. Those who are not here today obviously missed a great panel. We will be doing whatever we can to put this recording up on YouTube. And if you have any questions for us, the organizers, please ask us at hcsw@cogeco, that's COGECO.ca. So you can ask us any questions at hcsw@cogeco.ca, or go to the website hcsw.ca or Hamilton Coalition to Stop the War.ca, because there's a contact us section on the website and you can address any questions. They will come directly to us. This event, there are costs incurred with an event like this. If you want to help us out, give us a bit of a donation, there's a donate section on the website. Again, hcsw.ca, or you can send an Interact transfer to one of those email addresses. So thanks so much. Stay in touch with us. Follow us on Facebook and Twitter. Listen to Unusual Sources Wednesdays, 5 to 6 p.m. And above everything else, stay well. So thank you very much.
Thank you.
Thank you. And stay well. You stay well too.